Assalamu alaikum. The article for this week is titled as Effect of Orthognathic Surgery on Pulp Blood Flow and Pulp Sensibility. It's a prospective control trial done by Kamel et al. And in 2024 published on Journal of Endodontics. This study aims to assess changes in pulp blood flow and pulp sensibility of the maxillary and mandibular anterior dentition following orthognathic surgery. It's a single-center prospective control study conducted during the period between 2020 and 2022. They had 42 patients who had either conventional orthodontic treatment or surgical orthodontic treatment. This patient divided into two groups based on the treatment performed, either conventional or surgical. 16 patients for conventional and 26 patients for orthognathic surgery. In patients with a single jaw surgery, the unoperated jaw was counted as a control group. They used laser Doppler flow meter and the cold test to assess the teeth at different time interval, and participants were followed prospectively, and the pulp status was assessed at 4 time intervals defined as T1, T2, T3 and T4, which is T1 before treatment, either conventionally or surgically, T2 6 months for the conventional, and 4 to 5 weeks for the surgery, and T3 1 year for the conventional and 3 months for the surgery, and T4 18 months for the conventional treatment and 6 months for surgery group. And the result, this figure shows the pattern of pulp blood flow changes over time interval in combined maxilla and mandible in control groups. It's showing no statistical significant difference between different time interval for both the maxillary and mandibular controls group. For the maxillary surgical group, there were a significant difference between T1 and T2 and T1 and T3 and T2 and T4 in terms of pulp blood flow. In the mandibular surgery group, there were a significant difference between T1 and other time interval. There were no difference between maxillary and mandible and pulp blood flow at any of testing time interval. Regarding the pulp sensibility test, it was showing a similar pattern to pulp blood flow in surgery patients. All teeth were positive at T1, and the highest percentage of negative response were recorded at T1, which is 4 to 5 weeks for the surgery group, and it was 60% in maxilla and 34% in mandible. And the final recovery rate was 95% in maxilla and 97% in the mandible. They conclude that in single jaw surgery, the effect of surgery on pulp blood flow does not extend to the unoperated jaw. A significant decrease in pulp blood flow is expected 4 to 5 weeks post-surgery, followed by a gradual recovery to pre-treatment levels in the maxilla and mandible. Response to the cold test and or discoloration solely should not be used as indicator of ischemic changes in the pulp post-surgically, and pulp Doppler flow meter should be considered as a complementary test and should be considered prior to any decision to perform root canal treatment. And thank you.